Are the treatments we do for diabetic retinopathy curative, or are they just temporary? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. The answer to this question kind of depends on the situation. That is, if we're talking about curing someone, doing a treatment, never treating things again, bringing the vision back to where it should be, actually some things that we do are curative. There are some things that we do that are not curative, and that's definitely true. The fundamental way to cure diabetic retinopathy is to stay on top of the diabetes. That is, make sure that the A1C is, let's say, below 6%, good blood pressure, good cholesterol, make the endocrinologist happy, and the diabetic retinopathy will go away for the overwhelming majority of people. Now, if there are specific forms of diabetic retinopathy, for example, the proliferative kind, where there are whole sections of the retina not getting enough blood flow, new blood vessels form in response and bleed inside of the eye, then no matter how well someone controls their diabetic retinopathy, in many cases, the retina will have an eternal desire to bleed and fill the eye with blood, and therefore it is incumbent upon us, retina specialists, to make sure that we provide a treatment solution. Eye injections are by definition temporary. We inject the eye with medication, the medication wears off, and then the retina's desire to bleed and cause other trouble comes right back. It's totally true. I don't look at that like that's a problem. I mean, in a sense, if someone is blind and we provide a temporary treatment and it cures the blindness, I say, good job. Let's keep up the good treatment. And ideally, it would be better if we injected something into the eye or performed some medical procedure or whatever that would ultimately cure the problem. There are actually several. Number one, when someone has diabetic retinopathy of this variety, the bleeding kind, if we perform a surgical procedure, that is, remove the vitreous from the eye and then we laser the retina, at least, and I'm speaking from medical evidence in my experience, we cure, let's say, more than 90% of people. They never bleed again. The same might apply to even just lasering the retina. Assuming we didn't do a surgery, remove the vitreous, etc., and we just laser the retina, that's also curative, but for less, maybe like, let's say, 80% of people. However, like everything in nature, this comes at a potential cost. That is, if we laser the retina, then people's night vision might be worse, the peripheral vision could be affected, and frankly, it's kind of a pain to do. But that is available. That is curative. Now, if someone's saying, I own my own body, I don't want to have to deal with those potential issues, the difficulty of laser, losing some peripheral vision, having harmed the night vision, then what's the alternative? Well, eye injections. However temporary that might be, if we continue to do eye injections, say in perpetuity 4 times a year, let's say, then we'll actually be able to save the peripheral vision and night vision, and we'll be able to maintain the vision as well.